Okay, so this is the forearm structures that you need to identify in your cadavers. Okay. So first, you have to identify the cubital fossa. This is the cubital fossa. It's a triangular shape pit at the anterior surface of the elbow. So just place an imaginary line between the two epicondyle. Then you have your brachioradialis as the lateral border. Then you have the teres, pronator teres as the medial border. Okay? Mamaya ko identify yung contents, ha? So the superficial muscles on the anterior fascial compartment, what are those? Ano yung four? Pronator teres is one.
Flexor
palmaris longus,
Carpi ulnaris, palmaris longus, and the flexor carpi radialis. So if this is the thumb, okay, this muscle here is the flexor carpi radialis. Bakit hindi ito? Because look at the common tendon of origin.
medial epicondyle.
The medial epicondyle, hindi pwede to. Okay?
Lateral.
So your basis is the medial epicondyle. Look at the lateral most muscle, then that is the flexor carpi radialis, since it's nearer the thumb. Okay? The central tendon
Longus,
is the palmaris longus. Okay? So you can see the palmaris longus will just lie above the flexor retinaculum. Although I removed the flexor retinaculum to expose the other tendons yesterday. Okay? Then the third tendon is this one.
Flexor.
Okay. The lateral most, this one. So tatlo yan, ha? Okay. Okay. Hindi kasama to, ha? Ito yun. Okay. So 1, 2, 3. So this is your flexor carpi ulnaris. Okay. Can you follow? Okay. Now I will let you cut the belly of the three superficial muscles and then deflect. Okay. Now pag dineflect nyo yung superficial muscles, this will expose the pronator teres. This is your pronator teres. Okay? Can you appreciate the pronator teres?
Yes.
Okay. So, ganun yung direction ng fibers na, and this will insert on your ulna. Okay. Okay. So, ang ginawa ko dito ay remove the pronator teres. Okay. Ganito. Sorry. Ganyan ba? Okay. I remove the pronator teres, and this will reveal the intermediate muscle, which is the flexor digitorum superficialis. Diba, I instructed you yesterday that the median nerve, this is your median nerve. Okay? The median nerve will first pass under the pronator teres. So this is the pronator teres. Now if your pronator teres in some instances will get bigger, mag-hypertrophy, there is a big chance that this can impinge on your median nerve. We call it the pronator teres syndrome. Okay? So that's one. Okay? Now, when I remove the pronator teres, this will expose the flexor digitorum superficialis. Now, I instructed you yesterday that the superior border of the pronator teres will serve as a pocket for the median nerve. We call this the arcade of Ross. Okay? Ito, pwede niyo ipasok yung finger under the arcade of Ross. So, it's para siyang pocket. Okay? So, this is the flexor digitorum superficialis. And as it reaches nearer the wrist joint, it will form four tendons. Okay? So, ang ginawa namin yesterday, we cut the belly of the flexor digitorum superficialis, and this will expose the whole length of the median nerve. Okay? Now, if we're going to open the cubital fossa, okay, sabi ko, it is, ano yung mnemonic natin? Your tan. So, you have from lateral to medial, you have the tendon of the biceps brachii, yon yung white. Okay?
Artery.
This is the artery. This is the brachial artery.
Median nerve.
Okay? Here's the brachial artery. Okay? And then that's your median nerve. Okay, can you follow? Okay. So, tinanggal natin yung flexor digitorum superficialis. Underneath the superficialis is your ulnar nerve. This one. Okay. So, this is the flexor digitorum superficialis. So after the deflection of the superficialis, this will expose your flexor digitorum profundus.
Profundus.
Okay. And the other one is your
DGT minimi.
no, ito. Your flexor, sorry, it's not DGT. Yeah, this one. This is your flexor pollicis longus. So dalawa yan. Binuksan nyo. Then, if we're going to cut the flexor digitorum profundus, this will expose the pronator quadratus. Okay, so here's your pronator quadratus. Okay. Now, what about the artery? What will happen to your brachial artery? Your brachial artery, as it reaches the elbow joint, at about the level of the radial head, it will divide into two. Your radial artery and your ulnar artery. So, which is the more superficial? Based on it's your radial artery. Okay? So, mas palpable yung radial artery along the length of the forearm. Okay? And this will terminate the level of the wrist joint. Now, at the level of the wrist joint, this will course posteriorly. Okay? Now, what will happen to the ulnar artery? The ulnar artery, we will follow the ulnar artery. Ito pa siya. Okay, this is the whole length of the ulnar artery. This deeply embedded under the flexor carpi ulnaris and above the flexor digitorum profundus. Okay? Now, di ba I asked you to identify one branch of the ulnar artery, which is the common interosseous artery. So this is the common interosseous artery. Ayun po. Now, di ba I told you yesterday that the common interosseous artery will divide into two. An anterior interosseous and the other is the posterior interosseous. The anterior interosseous can be appreciated here. Okay? Just open this space. Okay? The white thing here is the interosseous membrane. Okay?
Connecting the ulna and the radius.
Now, for you to be able to identify the interosseous artery, look at the border, the superior border of the pronator quadratus. This is the superior border of the pronator quadratus, because the interosseous artery will go inside. Okay? So, dun nyo siya makikita. Then, trace it proximally and it will end up in the common interosseous artery. Now, what will happen to the posterior is that this will pierce the interosseous membrane and will supply the muscles of the posterior fascial compartment. Okay? Clear?
Yes.
Okay, so that's the anterior fascial compartment. Diba? Kita lahat? Dapat ganyan din yung cadaver nyo. Okay? Now, what about the posterior? Excuse lang. Okay, in the posterior fascial compartment, bakit biglang dumami? 10 people lang kailangan ko dito. Sinong group 1? 2, 3, 4, 5, 6, 7, 8, 9, 10. Kaya yung hindi muna representative lang kailangan ko. Representative. 11 to 20 mamaya. Okay. So, in the posterior fascial compartment, it is divided into two groups of muscles. Your superficial and your deep group. In the superficial, you have your brachioradius, your extensor carpi radialis longus, and this is your brevis. Okay, nakita nyo, 3 layers of muscle yan. 1, 2, 3. Brachioradius, ECRL, ECRB. Okay? Then you have here your extensor digitorum. Okay? Diba the extensor digitorum will form 4 tendons that will supply the 4 digits. Okay? Then you also have the extensor digiti minimi. Okay? Which will specifically supply additional tendon for the little finger. Then the last one is, ito, hindi ko na ito binuksan. Okay. This is your extensor carpi ulnaris. Okay. Your guide here is the ulnar style or the head of the ulna. Okay. Ayun siya. Can you follow? Okay. Now, if we're going to displays, the extensor digitorum, this will expose, napapansin nyo to, okay, itong two groups of muscle. Ha? Okay, this is the anatomical snuff box. Okay? Ito yung lateral, ito yung medial. Okay? So this is the apple and epep. So this is your apple, this is your abductor, ayun yung muscle belly niya, and this is your epep, extensor pollicis brevis. Then this one is your epol, extensor pollicis longus. Now what artery is appreciated inside
Radial
artery. Okay. This is the radial artery. Okay, that's the radial artery. So sabi ko, the radial artery in the anterior fascial compartment will course posteriorly crossing the anatomical snuff box. Okay? Now, di ba there are 6 compartments created by the extensor retinaculum. So you have the extensor retinaculum here. Tinanggal ko yesterday para ma-appreciate. Okay? So this is compartment 1. Okay? This is compartment 2. Okay? Created by the tendon of the ECRL, ECRB. Nakuha? Ito, tendon 1, tendon 2. This is ECRL, longest. Okay? And then ECRB, brevis or shorter. Can you follow? So this is compartment 1, this is compartment 2. Compartment 3 is the medial border of the anatomical snuff box. Okay, so this is compartment 3. You notice that the extensor pollicis longus will use the Lister's tubercle. This is the Lister's tubercle. Okay? This is the Lister's tubercle in order to open the anatomical snuff box. Without the Lister's tubercle, naka-close ang anatomical snuff box. Okay? So, yun yung importance ng Lister's tubercle. So, balik natin siya doon. Okay? Then, compartment 4 is your extensor digitorum plus the extensor indicis. Okay? This is specific for the index finger. Okay? Then, compartment 5 is extensor digiti minimi. Compartment 6 is the extensor carpi ulnaris. Okay? If we're going to open this, okay, we can now identify the supinator muscle. This is the supinator muscle. Now, I want you to identify the inferior border of the supinator muscle, and from there, you can isolate the posterior interosseous artery. Okay? Nakuha nyo? Galing dun yung posterior interosseous artery coming from the common interosseous, and dito siya lalabas at the inferior border of the supinator muscle. Okay? What about the What about the contents of the carpal tunnel? Okay. Ano yung mga contents ng carpal tunnel natin?
Superficialis for...
Okay, your superficialis is 1. So, 4 tendons yon.
Median nerve.
The median nerve. This is the median nerve. Here. Then, profundus 4 tendons. So, ilan na yon? 9. Ano yung isa?
Radial artery.
No, your flexor pollicis longus. Okay? So, 4, 8, 9, 10. They will all pass under the flexor retinaculum or in the carpal tunnel. Okay? Now, this is the thenar eminence. This is the hypothenar eminence.
Central.
Okay? Hindi maganda yung pagkakaano nila eh. Now, what I want you to appreciate is the superficial palmar arch. Okay? The superficial palmar arch is contributed by the ulnar nerve. Ulnar artery. Okay? Nakita nyo to? Okay, this is the superficial palmar arch. Okay? And then, this is the thenar eminence. The thenar eminence, the hypothenar. This is the central compartment. In the central compartment, you can identify your lumbricals. This is one lumbrical. Okay, lumbrical 1. Okay. Hindi nila na-dissect yesterday properly. Anyways, okay? Pag inopen ko to, okay, this is the adductor pollicis. Okay, this is the adductor pollicis. Okay? Okay, questions?
None so far.
Okay, so ganito yung gusto kong gawin niya sa cadavers, no? Move. Next, representative.